In this module, we are discussing how occupational performance is impacted by arthritic diseases. Arthritic diseases is like many of the conditions or all of the conditions we've discussed thus far this semester. It can be the primary condition, it can be the secondary condition, but as we work with the whole human, you might see arthritis or some sort of arthritic disease within their medical history. And this module or this chapter talks about two kind of categories of arthritic diseases. So first we'll talk about inflammatory arthritises, and all areas of occupational performance, all areas of occupation are at risk for negative impact with any disease or any diagnosis of any type of inflammatory arthritis. The systemic and chronic nature of these diseases cause pain, creates fatigue, reduces strength and movement, and ultimately reduces motor function needed for skilled movements that are part of most occupations, ADLs, IADLs, work, play, leisure, social participation. It should be noted that some conditions require surgical or other medical interventions that may temporarily limit the ability to engage in occupations, but the long-term outcome is usually improved participation. So rheumatoid arthritis, systemic lupus, erythematosus, gout, and juvenile idiopathic arthritis create pain and limited movement in the upper extremities, potentially the neck and spine, as well as the lower extremities. This can make it very difficult for individuals to complete ADLs, such as those requiring reaching, extending extremities, grasping securely, and releasing the hands fully. In addition, bending over to reach for feet for dressing and bathing can be impacted. So for example, donning upper body clothing can require full shoulder and elbow movements. Overhead style shirts and sweaters may cause painful neck flexion and weakness and fatigue and make movements slow and challenging. And this can increase frustration and loss of desire to participate in that activity. Pain and deformity in the feet can make putting on socks and shoes difficult and painful, leading to the potential rejection of secure footwear and possible use of slippers, which might be more comfortable and easy to don and wear, could increase the risk for falls. Bathing requires movements similar to dressing, and even with adaptive bathroom equipment can be challenging due to limited mobility of the arms, legs, and fingers. Washing hair and cleaning the back in addition to transferring to a tub or shower can be challenging. Toilet transfers and personal hygiene that require flexibility of the trunk, legs, and arms can also be problematic, leading to the need for adaptive devices and techniques for success. Consider fine motor limitations brought about by hand deformities and weakness can make self-feeding a challenge that requires adaptive devices for maintaining a grip on eating utensils. And the role of the caregiver cannot be underestimated in the case of functional limitations due to inflammatory arthritis. So for example, a child with juvenile idiopathic arthritis may need assistance with ADLs such as dressing or bathing and preparing for school. In addition to the child, the parent or caregiver becomes closely involved in the negative manifestations of the disease, such as assisting with ADL tasks as well as other occupations that may not be a parent or caregiver norm, especially for a teenager or preteen child. So that's just another added layer of complexity to the occupational performance of these clients. So considering IADLs, those same components, grip, reach, balance, endurance, fatigue, pain, how all of those impact ability to engage in IADLs. Health management, thinking about the chronic nature of these diseases, it's highly important for individuals to take care of their health. Self-advocacy is critical. Exercise, although can be an exacerbating component if done I don't want to say incorrectly, but vigorously. Exercise is important to maintain their flexibility and overall strength and endurance. So how to develop an exercise plan that is safe for these clients. Even consider opening bottles with the rheumatoid or with the joint deformities, and how that impaired grip strength and how that impacts health management. Rest and sleep might be, impacted as well. It is a well-known fact that sleep is an important part of overall health and well-being for all people. Inflammatory disease does not change this fact and can actually make sleep and sleep hygiene more important. But pain due to the disease process or overexertion, as well as medication side effects, can impact sleep. So another component to consider. So let's go and talk about the other kind of category of arthritis, which is non-inflammatory form of arthritis, or osteoarthritis. So it's not systemic and therefore does not lead to necessarily malaise or fatigue and generalized pain in the way that inflammatory conditions do. However, painful joints with and without activity, stiffness, and potential weakness can limit occupational performance, again, in all areas of occupation. So I think you'll see very similar joint deformities, pain, fatigue, that with the inflammatory styles categories also are impacting ADL or areas of occupation. You might see impact with pain and stiffness that are present in weight-bearing joints and joints of the hand. You might see challenges in the ability to climb stairs, walk reasonable distances, again engaging in fine motor activities. And you'll also see osteoarthritis maybe with some of your joint replacements and spine, hip, knee, shoulder replacements and surgeries. So I hope that helps. Don't hesitate to reach out with any questions.